Thanks very much for joining us for our daily briefing. First things first, we have 2,536 cases of coronavirus in Victoria. That is 74 more than the last update we provided you. Professor Sutton is here and can speak to any of the trends or individual matters you might want to follow up, but in headline terms, 16 of those are connected with controlled outbreaks. One of those 74 cases comes from a returned traveller in hotel quarantine. 4 of those are as a result of routine testing, and 53 of those cases are under investigation by our public health team. There are 26 Victorians in hospital, and 3 of those are in intensive care. I want to make special mention on a pretty rainy and miserable Saturday, 21,597 people were tested, and I thank each and every one of them for that seemingly small contribution, but a really massive part of our public health response. The whole strategy depends on knowing where the virus is and then putting in place the appropriate contact tracing and public health interventions to contain the virus. And without the testing numbers, without people coming forward and giving their time and consenting to a test, that is incredibly difficult to know exactly where it is and to put in place the appropriate public health response. So I thank each and every one of those more than 21,500 Victorians who yesterday, as I said, on a pretty miserable day, consented to being tested either on their doorstep or indeed attending the multitude of test sites that we have now stood up. That brings to a total of 928,171 the total tests that we have undertaken since January 1 this year. There are 543 active coronavirus cases. There are many, many thousands of close contacts that are at home. Police check on them. That's a really important part of the process, but I think it's important that Victorians recognise and understand that it's not just the 543 cases, it is many thousands of people who are close contacts of positives and people who are awaiting the results of their tests. It is a massive task to try and control the movement of those people, to try and make sure that they are away from others and are appropriately isolated. The number of people involved in that public health response, everything from door knocking to testing to contact tracing, it is thousands and thousands of people, but they can't do it on their own. They and I need every single Victorian to be following the rules, every single Victorian to be taking this seriously, and I am very, very grateful to all those Victorians who are doing the right thing. Now, in terms of lockdown postcodes, again, I want to send my thanks to each and every one of those families who, through their sacrifice, through the work they're doing on the front line of our fight against this virus, are not just protecting their own family, but playing a really big part in protecting all Victorian families. I know it's tough, I know it's very challenging, it's frustrating, it's not the position we wanted to be in, it's certainly not the position that you and your family wanted to be in, but we are very grateful to you and we'll continue to support you in any way that we can. Now, in terms of the most important challenge at the moment, and that is the large number of often very vulnerable Victorians in those 9 public housing towers, around 3,000 people. I've got a couple of announcements to make in terms of targeted and dedicated support, and then Richard will add to my comments, and then we're happy to take any questions you have. First things first, there will be no rent charged for those tenants for the next 2 weeks. Secondly, those who are employed and because of the hard lockdown cannot go to work, they will receive a $1,500 hardship payment. For those households where there is no one in employment, they will receive a $750 hardship payment. And just as they're receiving that support, there will be, and it's already started, there will be public health workers, nurses and others moving throughout each and every one of these floors and each and every one of the towers to test each and every resident, except of course those who have already been tested and have tested positive. I expect that everybody will consent to a test, because the sooner we have that testing process concluded, the sooner we'll be able to make decisions based on the data, the results of those tests, about the restrictions that are appropriate for those 9 towers. We also want to assure those residents, and indeed all Victorians, that there has been an enormous amount of work go on right throughout the night in order to provide food, essentials, drug and alcohol support, mental health support, family violence support, physical health care and support that's needed for those who have pre-existing medical conditions. The Community Connector program, which is a partnership between the government and the Red Cross, will be a single point of contact for each one of those 3,000 residents, so that they can, everything from just wanting to talk to somebody, to talk about their circumstances, all the way through to very specific and detailed requests to meet their needs. That has been stood up and will be there for each and every one of these residents. I also want to confirm for you that Tony Nicholson, someone who's well known to all of you and to many, many Victorians as a community services expert, former CEO of the Brotherhood, he will be playing a leading role in coordinating and providing support to those residents, and also providing feedback and being the go-between, if you like, between a multitude of service providers and those residents. This is challenging in many respects, in no particular order, but it's important for us to have a sense of the total challenge. We have many people who already have pretty poor health that have a whole range of pre-existing conditions. There are cultural and language barriers in terms of appropriately communicating with people. We're equal to that task, and we'll make sure that all of our support meets the very diverse needs within these towers. There are also just the physical challenges of a very closely confined environment, obviously with many shared services. This is not going to be a pleasant experience for those residents, but I just have a message for those residents. This is not about punishment. This is about protection. We cannot have a cohort of people, many of whom, not all, but many of whom, are in poor health to start with. We can't have this virus spread. We have to do everything we can to contain the virus, and that's why staying in your unit, staying in your flat, is absolutely essential. If we have a large group of people who've already got pre-existing and underlying health challenges infected with this virus, then people will die. It is as simple as that. These towers are being treated in a public health response sense no different to an aged care facility, and that is exactly the right way to go, given the inherent vulnerability, not of every resident, but of many, many residents. All support will be provided. It'll be done in a culturally appropriate way, a linguistically appropriate way. We will meet all the needs of each and every one of those residents. Are all of those needs absolutely crystal clear right now? No, I think they'll evolve over time. That's why people are working extremely hard, and we'll continue to listen to those residents and hear from them firsthand about what they need, and then seek to meet those needs. Can I thank Victoria Police? Can I thank the social workers, the clinicians, the teams in various government departments who literally have worked all night to make sure that we've got the appropriate supports for a vulnerable group of Victorians. This is about making sure that we protect them in the first instance, and if we can achieve that outcome, well, that will protect public health in a broader context. Just finally, all the usual messages have not changed. If you are sick, the only reason to go out is to get tested. If you're in a lockdown suburb, then obviously you need to follow the rules. If you're not in a lockdown suburb, there are rules that apply to you as well, and you need to take those rules seriously. And I just, again, if I can ask of all of those who are not in a lockdown postcode, if you want to thank those who are, if you want to send a message of support to those who are, then the best thing you can do is follow the rules, use common sense, and if you've got even the mildest of symptoms, come forward and get tested. That gives us visibility, it gives us clarity about what we're up against. And in order to put this public health bushfire out, we need to know where the front line is, we need to know where it's spotting as well, where it's moving. It is no different to the challenges that we were equal to in summer. We will get across this again, we will stabilise these numbers, we will drive them down, but know even an army of public health workers, and there are thousands of people out there doing this work. They can't do it on their own. They need every Victorian to play their part. For those who are, I'm deeply grateful. For those who've got to make some decisions about whether they follow the rules or not, please do the right thing by your family, and in so doing, you'll be doing the right thing by every single Victorian family. If I can now ask Richard, who not only is the Minister for Housing, but someone who's had a deep and close connection to these towers and to these residents over a very long period of time, if I can ask him to add to my comments, and then we're happy to take any and all questions you have.
Thank you very much, Premier. So this is obviously a very, very challenging time for all of our residents on the two very significant public housing estates at Flemington and North Melbourne. This is very personal for me because I worked on the Flemington high-rise estate for 7 years. I know that community. I know that community intimately, and I know the issues that they are confronting. I also live 50 metres from the North Melbourne public housing estate, which is in lockdown. This is a community that I grew up in. This is a community that is part of my world. It's a community that we shop together, we live together, and to see them in lockdown now is something that's very challenging. But we know absolutely that this is the right thing to do for these people, because as the Premier has said, at the end of the day, this is about saving people's lives. I'm very comfortable that we have put in place all of the measures that we need to put in place, not just in terms of the lockdown, but the supports that are now in place in each of those towers, and indeed right across the area. I'm really overwhelmed by the compassion of so many Victorians who, frankly, my phone has rung off the hook with people saying, how can we help? From the Lord Mayor of Melbourne, the City of Moonee Valley, Trades Hall, any number of people who've said, we want to be able to help because we know just how important it is as Victorians that we in fact reach out. And it just shows yet again, as the Premier alluded to earlier with the bushfires, just how compassionate Victorians are. I want to reassure all of our public housing tenants that we will take this pathway with them. We will stand with them, absolutely, and we will ensure that all of the resources that they need to maintain their health are in place. We have in place a culturally diverse leadership who are on the ground now. As the Premier has indicated, we've got all of the professional services are there on the ground now. Drug and alcohol services, mental health services, medical services, and this is why it is so important that we get on top of this. The infections are obviously troubling, and we need to ensure that through the work that is being done, that we both manage this virus in this high density environment, but also ensure that people remain well. Thank you.
Happy to take any questions you have.
Premier, just practically, how are those services being facilitated? Translators, mental health support workers going door to door? How do residents put their hand up to say they require things like food?
So part of that single point of contact, that important partnership, the Community Connector partnership between the Red Cross and the government, that is an opportunity for people to have a single point of contact, that is residents and their families, to be able to reach out for whatever it is that they need. And those requirements are varied. It'll be everything from food and baby formula through to food for a pet, for instance. There are many, many different needs. It's a very diverse community. Any community of 3,000 people is going to have lots of different needs. So giving them that sole single point of contact, and I can assure you there's everything from social work, mental health support, drug and alcohol support, all the way through to the basics, the practicals, from nappies to food. We've put basics got in there yet last night. There's much more advanced care and support from, for instance, meals and things of that nature today as we ramp up kitchens and other important services. So it's a very broad but targeted response. because the needs of that community will be equally so.
Is that someone actually just knocking on their door?
Well, part of the challenge, Jodie, part of the challenge is this is a lockdown area for a reason, and that is because there are positive cases in these towers, and we of course have to limit the amount of movement around the towers. Even with the best PPE, you would always try and limit the amount of contact between any person and multiple residents. To that end, there's welfare checks. There's people there'll be some door knocking, but we always have to try and make sure that we treat this as an infectious environment and one where nothing we do contributes to that.
People have been filmed.
Well, this is a hard lockdown, and the best way to protect each and every one of these residents, and beyond that, each and every Victorian who might be susceptible to this virus, and I again make the point, there are some people in the community who believe that this is a sniffle, this is something that's very mild, and because they're in good health, they'll be fine, even if they were to get it. The key point is that there is a lot of international evidence to show otherwise healthy people becoming gravely ill and some indeed dying. This is not just a condition or a virus for the vulnerable. It most certainly affects them, but it can affect otherwise healthy people. In terms of what we're trying to achieve here, it's the protection of those residents and then the broader protection and the preservation of public health across the whole state. It was not the health advice to be giving people hours and hours and hours of notice. This needs to be a lockdown, just like an aged care facility, where because of the inherent vulnerability of at least a significant portion of the population in these towers, a hard lockdown, just like aged care, was what was deemed was appropriate. Again, there'll be mixed views about whether that was the right way to go, but that's the public health advice, and we're well served by following the public health advice.
What happens to those people that weren't or didn't come home last night? Are police actively looking for those people?
I think I'll leave it to police to deal with those matters, but in the first instance, properly policing the hard lockdown in the first instance, that's the priority that police are working towards. I'll receive some further reports on those issues today, and if there's a strategy that needs to be put in place for those people, then of course we will. Everybody will get a go.
There are residents that were saying they were caught out last night, they couldn't go and get groceries, they were already short on supplies, they still haven't seen any food at their doors this morning. When will they be getting it?
As soon as we possibly can. We don't for a moment pretend that this is easy. We know that there are very significant needs, whether you be a vulnerable person in the towers or not. We are literally, people have worked all through the night, a very large team, to provide support, everything ranging from food and basic supplies all the way through to mental health and other personal care support. This is a massive logistical task, but I think we're equal to it. Again, I'm not pretending that this is pleasant for anybody involved. It isn't. It's a very difficult decision. It's not one made lightly, but it is the right public health response, particularly given the vulnerability of so many people in these towers. We will get to every single person what they need. That can't be done instantly. It does take some time, but we're all working as hard as we possibly can to protect those residents, to support those residents, and to protect public health more broadly.
There are community service groups who are ready to go now. There's one group that has 1,000 meals ready to go, but they're being told that they can't deliver that food. Will they be allowed to be part of this solution?
Of course, there already are many partnerships that have been stood up. We will always work with those who have the capacity to support us in our important work, but I think they would understand. I'm sure you understand, and those watching this will understand that we can't have, in a hard lockdown environment, we can't have people moving freely in and out of that. That would absolutely defeat the purpose of having locked these residents down. We don't enjoy having to do that. It is the appropriate public health response, but be in no doubt, I want to, just as the Minister has, I want to thank people for their care and compassion, the generosity of Victorians sticking with each other, looking out for each other, always being mindful of those who are in the toughest position. How we treat them is a really important measure of our strength as a state, and we always come through for those people, whether it be in fire or flood, or in a public health bushfire like this one. Having said that, it does take some time to connect all of those offers. It does take some time to be able to get that support on the ground, as it were. We'll have some more to say later on today about a single point of contact for all of those Victorians who, through compassion and care, want to be part of supporting those 3,000 residents. We're just finalising that at the moment. We'll have some more to say about that later on in the day, and there'll be a single point of contact where people, because of their circumstances, can be generous towards others. Large and small donations, offerings, whatever it might be, we'll give people a single point of contact for that later on this morning.
What will you
Obviously,
do
when
when point
people-
of contact, just practically, if a number of these people don't have access to internet and you can't have dozens of people walking hallways, practically, how will the services be implemented?
Well, let me give you one practical example. We are at the moment in deep conversations with Telstra and others about whether there are some Wi-Fi solutions, whether there's some internet connectivity solutions that we can bring to these towers. That's not finalised, but I just hope that example gives you a sense that we are going right through a long list, trying to be as creative, trying to be as innovative, but also listening to residents as well. This is their home, it's their community, they know and understand. I can't think of a better person to be these residents' voice within our government than a minister who spent 35 years working in and around this community, living in this community, living 50 metres from one of these towers. Richard is making sure that their voice is heard and that their needs are met.
What will you do if a significant number of people refuse to be tested? Is there a limit of, if we get 10% refusing tests, we'll keep them in lockdown for longer?
Well, let me go back to first principles. There's no reason not to be tested if someone invites you to be tested. The only outcome of not being tested will be that we have to assume that you are positive, that you have the virus, and you will need to remain in your unit for a longer period of time than would otherwise be the case. So I want everyone on the estate to say yes when someone approaches them for a test, and because that's just the clearest and easiest way for us to get a complete picture of how much virus there is, and then have these very challenging restrictions lifted as soon as they possibly can be. I wouldn't, however, I wouldn't predict or forecast that there will be large numbers of people who don't get tested. I think people know and understand it is for their protection, as well as the protection of public health, and there's an abundance of caution in this hard lockdown. We will, once we have evidence and data from testing, we will then be able to make fresh assessments about what the most appropriate public health response is.
If you treat them as positive though, will you then enforce a further lockdown on those residents and have police outside their doors?
Well, I wouldn't go to the level of detail about where police might or might not be stationed, but in terms of anyone who refuses to be tested in an environment like this, and I think there will be a very small number, if any, that won't be tested, because I think those residents, and my message to those residents is consent to the test, agree to the test, let's find out exactly how much virus is in these towers, then let's make sure we provide care and support to those who need it, and then we can reassess not off assumptions but off real hard data, the facts of this matter. Then we can make assessments about what the most appropriate restrictions are for the future.
Premier, you've referred to this as a public health bushfire. Where are we at in terms of extending the lockdown beyond those 12 postcodes and the likelihood of that happening?
We have when I say we, the public health team have developed a very clear formula that deals with the incidence of the virus, the number of cases against the state average. That's well and truly laid out, and each day, and then in aggregate form across the course of a week, we then assess whether other postcodes, the best way of probably describing it is whether they're green, amber or red, and then we have to move potentially to other postcodes being locked down. I'm not predicting that. I'm simply trying to be clear with Victorians by saying I can't rule that out, just as yesterday we added 2 further postcodes into the stay-at-home orders, the stay-at-home with 4 reasons to leave. The 9 towers are over and above that because of the inherent vulnerability and the unacceptably high risk of the worst outcomes, and that is significant onset of illness and death. That's what's driving us, and my message to everybody in those towers, this is about protection for you, your loved ones, and then by extension, it's about protecting the entire state. We don't make these decisions lightly. We will get you all the support you need. It'll be challenging, of course it will be, but we are there to make sure that you get through this and that we all get through this.
And where does your support stand with people working in the hospitality industry or other businesses that have said that a second wave and closing again would absolutely kill them?
Which is, which is why we're taking these matters so seriously, and it's why it's not easy to have to lock down 12 postcodes, but that's exactly what we've done. because to do anything else would make it almost inevitable that we would finish up with the whole state in a lockdown. That's what we're trying to avoid. We're trying to contain, bring some stability, and then drive down case numbers and get back in control of this across the board. That's what we are trying to achieve, and we are all working extremely hard. Thousands and thousands and thousands of people 24/7 are working to deliver this strategy. This is not the position that we wanted to be in, but this is a wildly infectious virus. We've been very clear all the way along that we would see, as part of a suppression strategy, additional positive cases, additional outbreaks. That's why it's so important that everyone work with me and my team, a team that comprises thousands of people, but even a team that big can't do this alone. We need everybody to follow the rules, use common sense, and fundamentally understand this. No one will be spared the cost of a second wave. It will affect everyone. Everyone. So no matter what your motivation, whether it be civic duty or your high regard for your next door neighbour or others you've never met, or just your own interests, everyone should be motivated by doing the right thing, because everybody will pay a price if we can't bring this back into a sustainable level, get it back to a sustainable level. It's not 0 days we're chasing. That'd be a great outcome. But this is with us, and it's going to be with us for a long time. It is getting it at manageable levels so that, again, it is stabilised, we drive down case numbers, and then we can have some incidence of the virus in the community until we get a vaccine, but at low and manageable levels. Everybody has a stake in that, even those who perhaps aren't taking this seriously. And I think that's a small number. But the message to them is very clear. It is serious, it is real, and we all have a part to play in delivering the National Cabinet strategy to have a small number of cases, but a sustainable number of cases, a controllable number of cases. That's what we're working towards.
Premier, are you concerned for the people that live in these towers who have drug and alcohol dependence issues?
There are,
and is
yes,
pharmacotherapy being
it is. Pharmacotherapy, methadone and other programs for those who are registered clients, for those who may need that support. There's been a lot of work go on overnight to make sure that we can connect those people with the services that are very important to them, just as mental health support, just like basics, food, all the care, trying to support the kids in the towers as well, giving them things to keep them occupied and busy right across the board. We are every hour building to our comprehensive list of needs and adding to our comprehensive list of needs within the towers, and then working extremely hard to meet all of those needs. Some of that will take a little bit of time, but we do know and understand how important those pharmacotherapy services are, and they are, as I'm advised, my last report an hour ago was that they've already begun being rolled out.
What
Can you
training
confirm
have
that
police
Qantas
officers
and
had,
Jet-
sorry, what training have police officers had to deal with specifically the public housing lockdown?
As you would have seen, there were a large number of Victoria Police out there to guarantee public order and to guarantee the terms of that hard lockdown. I want to make it clear to all of those residents, again, this is not a matter of punishment. This is not a matter so much of law enforcement. It is about delivering the orders that are there to protect you and your family, many of whom, as you well know, have poor health to start with. I'm very confident that both from the Chief Commissioner Shane Patton all the way down to those who are on the ground running this massive police effort, they know and understand full well their obligations and what's required when it comes to limiting the spread of this virus. I'm very confident of that.
But this is the first lockdown of its kind in Australia. What specific training have police officers had so that we don't end up with a similar situation to what we had with the hotel quarantine and security?
Well, what's occurred at hotel quarantine is the subject of an inquiry, and I'll let the inquiry come back with the answers to those questions. I think that Victoria Police are appropriately trained, they are appropriately briefed, they take these matters very seriously. I am reassured by the approach that Shane Patton as the Chief Commissioner is taking, and I've certainly seen no suggestion to the contrary. Each and every member of Victoria Police who are deployed in these roles and the many other roles. You've seen the footage, you've in fact filmed the footage and put it to air, and I'm grateful for you. The enforcement activities checkpoints, booze bus type arrangements in lockdown suburbs. Police are taking this very seriously. Masks, gloves, all those sorts of usual processes. I have no doubt that every member of Victoria Police who's engaged in this work across the state, no matter what that work might look like, know and understand that they can't be contributing to the spread of this virus.
How
Can
many
you
are on
confirm that
hotel
Qantas and Jet
quarantine?
staff are being trained then?
Sorry?
Can you confirm that Qantas and Jet staff are being trained to be rolled out in the quarantine hotels? And if so, how are they expected to be more successful than security guards?
Oh, I've got no announcements to make in relation to hotel quarantine other than to say to you that Corrections Victoria, there's a reset to this program and Corrections Victoria have the lead, and I think they are the best qualified people to do this important work. After all, they run our jails, they know exactly how to deal with complex and challenging environments, and that's exactly why they are in charge.
How much notice was given to police last night?
We were in conversations with Victoria Police throughout yesterday, and I'm very grateful to the Chief Commissioner and to others who are central to this important work, particularly Commander Mick Herman, who, as I said yesterday, is well known to many Victorians, if not by name, then certainly by his leadership during the bushfires over summer, when he coordinated the evacuation of, I think, in the order of 80,000 people. He knows he's exactly the right person to be doing this. He'll be supported by a large team of others, but Victoria Police have done an outstanding job and they will continue to.
Can you give us a breakdown of just how many police are working at these towers, how many nurses are there, how
Sure.
many people are actually...
I think I might probably be best if I came back to you with a bit more of that detail. That's pretty fluid and changing, and I think you'll see those numbers grow. My last advice is that from a police point of view, it's at least 500 per shift, and it's a combination of those who are securing the perimeter of these towers, as well as police on each floor, who are essentially monitoring and making sure that people are compliant and are staying in their home, not using shared spaces. So beyond that, it's probably best if I get some further detail and provide you with the most contemporary and the most accurate answer to your question.
With
Can we ask
hotel
Brett,
quarantine,
just
before we ask Brett, with hotel quarantine, people were allowed out once a day to get some fresh air. Are we going to see a similar thing with public housing tenants, given you've got overcrowding in some, you've got parents with lots of kids, and you've got people with pets?
That is not settled at this point. We'll look to try and find a safe way to do that. It is possible that there is no safe way to do that en masse, and therefore we'll have a localised response. I'm afraid I can't give you a definitive answer to that question. The key point here is to make sure that the conduct of everybody across these towers, both those who live there, those who are working there to support each resident, and those who are securing and delivering the order, making sure that it actually works, do nothing whatsoever to contribute to the spread of this virus. I can't give you a definitive answer on that issue, but it's one that we are working through with leaders in each of these towers, those who speak for other residents, and indeed on a very personal and individual level.
And who is overseeing the program? I know you're obviously the leader of the government, but which ministers or which bodies are the ones kind of making day-to-day judgment calls on how it's going to develop?
There was a CCC meeting yesterday afternoon to confirm these arrangements before they were put in place. There will be, as there has been right throughout the pandemic, a mixture of that crisis council as well as full cabinet, principally from a coordination point of view. Minister Wynne, as the housing minister, will have the lead when it comes to particularly the support services, trying to coordinate that into one place across government. I think that makes perfect sense. You had something for Brett, yeah?
If that's all right, if we could just ask Brett the
Yeah, sure,
specific
no worries.
breakdown of the amount of new cases within the public housing buildings.
Sure.
Sure. There have been 4 new cases linked to the public housing buildings today, so it brings to 13 the number in North Melbourne and 14 to the number in Flemington. So it's 27 today, up from 23 yesterday. I do expect more to be found. The reason why these measures are in place, understanding how desperately challenging it is for people, is because this environment, this specific setting, has genuinely explosive potential for the spread of this virus. It's not about the people who are there. It's about the entire environment and the way that people interact, and the issue of how easily that virus spreads. And so I think this is an appropriate public health response, but it carries significant dangers not to be able to oversight that lockdown very strongly.
When you say explosive potential, are you also referring to outside of the 3,000 people living in those 9 towers?
Yeah, of course. If this had exploded within the towers and there were literally hundreds and hundreds of people who became infected and they were going about their normal business, some of whom might be in the process of developing symptoms or who had very mild symptoms and hadn't been tested, then it would have spread beyond these towers and beyond the postcodes even. So I think the early, if imperfect, control is the really key element here, so that we can get on top of it.
How are the tests being administered to residents in the buildings?
They'll be getting swab tests from appropriately trained staff to do that door to door.
And saliva tests will be available to them as well?
I don't know that saliva tests will have a role here necessarily, but we know that we've got a saliva test that's in process. It's part of the pilot testing that's being done. We will have it in our toolkit if required, if it's a specific barrier for some families. There'll also be walk-in opportunities for testing for people, as has been the case across Victoria.
Was there a breakdown on the other cases confirmed today between hotspot postcodes and the rest of the community?
There are 16 new cases linked to outbreaks. So 2 new healthcare worker cases linked to Northern Hospital Epping Emergency Department, which brings it to 5. 2 new cases linked to the Stamford Plaza outbreak. One's a household contact, so would have already been in quarantine, and 1 contracted security guard, also already in quarantine, taking the total there to 42. There's 1 new case linked to the Truganina family outbreak, 8 new cases linked to the Altaqua College outbreak, 1 new case and 1 previously under investigation that's been linked to the Flemington public housing outbreak, which has been added to today's total. 2 new cases linked to the Roxburgh Park outbreak, both close contacts of a known case, and 2 cases previously under investigation that have been linked to the North Melbourne case. So they're basically newly linked cases.
In terms of where the cases are coming, how many are in these postcodes that are locked down and how many are outside them?
It's definitely a mix. We've got a number of postcodes where there are single or 2 cases, most frequently, that are outside the restricted postcodes. The concentration is absolutely still in the restricted postcodes. So whether or not some of those cases, and we'll investigate obviously as we do every day, exactly how they might be linked, but it might represent a spillover from these restricted postcodes. If we identify these individuals and they're not transmitting to others because we have their close contacts in quarantine, then that's less of a concern. But as we do every day, we would look at all of those postcodes inside and outside the restricted area to see whether there's growth in those numbers, to see whether there's actual community transmission occurring.
Brett, were you notified in April of concerns in the quarantine hotels?
As you know, the quarantine process is the subject of a judicial inquiry. I look forward to being able to speak then.
That sounds like you're not denying it.
I am looking forward to being able to contribute at that judicial inquiry.
Are you aware
do we need an inquiry for you to tell us when you personally knew about something?
Something that is the matter of a judicial inquiry should not have commentary prior.
Are you aware if airline staff are being trained to work in the quarantine
No, I'm not.
hotels?
Some of the residents of the public housing were saying that prior to the lockdown they had a couple of hand sanitizer dispensers and a couple of signs in Chinese and Arabic that was it. If this is such concern, which it is now, should health authorities have done more prior to this?
Well, I might allow Minister Wynne to speak.
We've undertaken quite significant deep cleaning of all of our public housing towers for the obvious reason. And we know that if we have to do more, of course we will. And I've already instructed the department to ensure that in all of our 47 towers, we've got 47 high-rise towers dotted right across metropolitan Melbourne, that we not only enhance our cleaning program, but we ensure that we have got all of the appropriate language information in place, and we will continue to monitor that going forward. But certainly you can be assured that the deep cleaning, both of the common areas, the lifts, and indeed the common walkways, has been very significantly ramped up since the start of the COVID virus for all of the obvious reasons of the potential vulnerability of our tenants.
Practical question, are there landlines in each of the units?
Landlines as in telephones? Oh, well, yeah, they're all wired for landlines, absolutely they are.
So
Yeah.
they can all call a specific number when we have one?
Sure. I mean, many people, of course, have mobile phones now, but yes, there are landlines in all of our public housing units.
Right, can we just ask, have you been able to practically find the source of any potential outbreak in these public housing buildings? Where have the cases come from?
Look, I think it's probably been introduced from the general transmission that's occurred in the north and west of Melbourne. We won't know necessarily who the index case is, the person who might have introduced it into this setting. The first person who's identified or notified to us isn't always the very first person to have become symptomatic or the very first person to have picked up the virus. I don't think it's a material issue at the moment. We've got transmission across many parts of Melbourne. It'll be introduced into new settings all of the time. It's not a question of apportioning blame or focusing on the individuals who might have brought it into particular settings. We need everyone to have an awareness of getting tested, of making sure that they're isolated when they've got symptoms. I do know that the majority of people with significant symptoms, fever and cough, are stepping up for testing. It's more of a concern that people with the milder symptoms are not coming forward at the same kind of rate. And so I would re-emphasise sore throat, runny nose, genuinely mild symptoms, even a change in smell or taste can be an indication of coronavirus infection, and people should consider those symptoms as well when stepping up for testing.
Are there cases in all 9 towers?
No, there aren't. That's in part what the hard lockdown is for, to ensure that we're testing absolutely everyone across all of those 9 towers. I think there's a not insignificant chance of finding cases that haven't yet been identified in some of those towers. There's a lot of exchange of individuals between those addresses, and so we have to work on the precautionary principle that transmission might have occurred across towers that we haven't yet had a notified case from.
Can you tell us how many haven't had a case notified yet?
No, I can't.
Are any of the public housing cases linked to hotel quarantine?
I don't know from the genomics what these public housing cases will be like, but it'll be the genomics that'll tell us that potential link.
Is the North Melbourne family outbreak linked to H&M?
I'd have to check on the name of that outbreak, but H&M has been linked to a family outbreak in the north of Melbourne, yes.
And is that family outbreak linked to these towers?
I don't know. Again, there is lots of transmission going on across Melbourne. There are new links that we identify all of the time that bring what have previously been named as separate outbreaks together, and we identify how those connections have been made. But each of those outbreaks need to be addressed on their merit by identifying every one of those close contacts and making sure that they're quarantined. It is reassuring to an extent when we find out how it's introduced into particular settings. By the same token, we've got 10-15 cases where there is no community link that we can find, so-called community transmission cases every day. They just need to be addressed on merit through the isolation and quarantine measures.
Can I ask?
Sorry, if I can just ask, 108 cases yesterday, 74 today. Where do these kind of figures sit on your level of concern and when you are doing the aggregates and so forth?
I remain concerned by big numbers like we've seen even today, even though it's down on yesterday. I don't think we've turned the corner yet. I think we can see other big days ahead of us, especially as we ramp up testing and focus on those areas that we know are at risk, including these towers. So I, again, can't say it enough. We cannot be complacent on a day-by-day basis until we really see cases driven down for a sustained period of time.
When did you observe the first case in these towers, and what was the trigger to say, yes, they right, we need to lock them down?
It was last week that we identified the first case, and it was really on that day that we knew that there was really significant potential for transmission, and so there was a very rapid outbreak management team gathering to look into those cases because they were really notified at the same time. We looked into whether there was any link between them so that we could again understand whether the transmission between particular apartments was known. But regardless of that, we knew that this was a setting that had really significant potential to take off, which has happened thus far.
So why did you wait a few days then from when you first knew the case?
So that we had to look into each and every case there. We had to do testing to see how widespread it was, whether it was confined to a single tower, whether it crossed other towers, whether it crossed floors, and whether there was a direct and known relationship between those apartments. But once we had an understanding that there was a significant number of cases that weren't necessarily linked to each other, we knew that we needed to take these measures.
Premier, can I just ask, the sight that people in these public housing buildings are seeing from their windows is large police vans and large police presence, as opposed to, say, an asylum seeker resource centre structure or something of that nature. Are you worried about the optics for people in these buildings, particularly with the language barrier?
Yeah, look, I think that that's why it's important to make the point very clearly that this is about protection. This is about protecting each and every family that lives in these towers, and then by extension it's about protecting each and every family across our state. Perceptions and optics are not unimportant, given that there are some cultural and language barriers within the towers, but if the question relates to how things look more broadly, I think action is what's important. Getting this job done is what's most important, and that's what we're all focused on. Can I just pick up on a point that Professor Sutton has just made? Obviously 70 odd cases is better than 100, but we're going to see some big days, big numbers in the days ahead. You can't go and test 3,000 people in such a focused and concentrated way and not have numbers go up. We might be pleasantly surprised and they don't, but I think it is far more likely that we're going to find what we're looking for, and that's the strategy working. There's no good not knowing about virus that's out there, and then the only proxy measure becomes the number of people presenting at hospital for a machine to help them breathe. We are out there searching in a more intensive way than anywhere in the country at any time during this global pandemic. That will turn up more cases. That's exactly what we want. That's why it's so important for people to come forward and get tested, even if they have the mildest of symptoms, even if they don't live in one of these lockdown postcodes. By knowing where the fire is, you are best placed to then develop a strategy to put it out. That's the logic of this. So I'd ask people, obviously there's a cause for concern here. There is significant and unacceptably high transmission in the Victorian community. But if numbers grow, that will be in large part a function of doing more testing than has ever been done in a really concentrated way. They may need to go up more before they start to stabilise, and then we get into a position where we can drive them down. I'm not predicting that, I'm just being as frank as I can be about what I think the next few days may well hold.
Some signs in windows say help me. These people, many of them report they haven't been spoken to since lockdown started nearly 18 hours ago.
We are
so
getting,
when are they going to be door knocked and told what's happening?
We are getting any and all support to each and every resident as quickly as we possibly can.
When will it reach everyone?
As quickly as it possibly can. And I will make the point that there will be significant disruption, significant difficulty for each and every one of those residents. But I would just remind you and all Victorians that the alternative, which might be less challenging for a few days, might be more popular even for the next few days if we had not made the decision we made last night. But I don't want people dying in these towers. I want to do everything I have to do, whether it be popular or not, to get this job done. It is about protecting the most vulnerable. And yes, it will take some time to get to every single resident, to meet every single need of every single resident. But it was a long night. In fact, it was the longest night for many people last night to put in place all the different supports. That's happening. That will continue to happen. We will take care of these people as best we possibly can. And that's not an easy thing. It's not a simple thing. It's very complicated, but we will get it done. And I'm very grateful, very, very grateful to everyone who is providing services and every Victorian who have found, through that sense of compassion, that sense that we are all in this together, have found it have seen their way clear to make offers of support. It's a heartwarming thing.
Premier, given the importance of knowing exactly where these cases are you still confident, and perhaps this is a question for Brett, are you still confident of Victorians, even from non-lockdown postcodes, travelling across the state, hitting up ski fields and other holiday destinations before school goes back?
We've made it very clear that if you are unwell, then you should not be leaving your home, other than to get tested, even with the mildest of symptoms. Again, common sense. There are a series of different restrictions and different rules. I think people are well and truly acquainted with what is required of them. And back to the point I made a little while ago, if people think that they could perhaps ignore this or pretend because they want it to be over that it is over, that is not the right judgment to make, because every single Victorian will pay a price if Victorians act that way. Every Victorian will pay a price. Now, let's continue to get those positive messages out to people about using common sense, using good judgment, getting tested if you're sick. If someone knocks on your door to test you, the only answer you should give is yes. And if you see someone in your family group, in your friendship group, in your street who is, not taking this seriously, then call them out. It is really important. We will all feel the impact if this gets away from us comprehensively, because I won't be locking down 12 postcodes. I will have no choice but to lock down all postcodes. So everyone has a part to play in avoiding that happening.
Do you know, Premier, how many residents last night were accounted for, or percentage of residents?
I don't have that. I don't have that data.
Could I just ask Brett about
Certainly.
one more outbreak?
Sure.
In the release last night, there was mention of a healthcare worker at the Park Royal Hotel near the airport. What do we know about that? Are there other workers in quarantine? Do we know where and how the healthcare worker got infected?
No, I'll have to update you after this. Right. Sorry
Any
about
other issues?
Thank you.
If not, thanks very much.
Thank you.